I'm Dr. Katherine Ramos. I'm an assistant professor at Duke University in the Department of Psychiatry and Behavioral Sciences, and my training is in counseling and clinical psychology. Palliative care is an interdisciplinary specialty, but also approach to care. And that field is really focused on how do we optimize the quality of life of patients who are living or diagnosed with serious life-limiting illness. So palliative care is really a nice field that really takes a look at the whole person and really is there to optimize not just the care of the patient, but they also want to optimize how the families are coping in this particular context. With palliative care, it's actually considered a consultation service, so that is independent of the standard of care that's offered with glioblastoma. And so the way that it would work is that when an individual is diagnosed, for example, they can actually ask their provider, their oncology provider as an example, that they would also like to get connected with palliative care. And so a consultation service would then be queued so that that particular provider would be able to meet with the patient and family. So that's a really also unique aspect, I believe, of palliative care, of really kind of putting everything on the table and really listening to the patient and the caregiver of what matters most, how do you see yourself living your life moving forward, what does quality of life look like for you, and here are all of your options. And that conversation can be revisited time and time again throughout the course of care. In the case of glioblastoma, given this type of disease and how it just has such devastating impacts both on the family and the patient, it can be such a wonderful added layer of support that I do believe patients and families would stand to benefit. And so I really just want to encourage patients and families to think about how they could really benefit from palliative care, and thereby also really think about how they're living their lives in a way that's meaningful to them.